following program is rated GE. It is suitable for general family viewing.
Good evening and thank you for keeping it TV 47. You are just in time for Body Garage with I, Sheila Chelangat, where on this episode we are focusing on respiratory illnesses in children, specifically the upper and lower tract. And with me is Dr. Ora Nzinga. How are you, Dr.?
How are you, Sheila?
I am doing good. How are you doing?
Thank you for having me. I'm doing well.
Could you introduce yourself to us?
So my name is Dr. Ora Nzinga. I'm a pediatrician. That's a doctor who specializes with the care of children. Children are people below the age of 21 years.
And so it's important to highlight.
Yes.
Because I can say I'm children.
You can say you're children. Many adulting has been hard. Many want to identify as children.
Yes.
So yeah, 0 to 21 years, that's my cohort.
Perfect. Now we are focusing on respiratory illnesses and it affects the upper and lower tract. So where is that first in the body? What does it comprise of? And what causes this, illnesses? Okay.
So first, let's define what respiratory illnesses mean. So respiratory basically means anything that is associated with air. With breathing, because respiration means breathing. So anything from the nose, the mouth, into this part we call the larynx, feeding into the larger airway that we call the trachea, then it divides and the air goes into our lungs. So that's basically what the focus of respiratory illnesses are. And when you talk about upper and lower, it's again divided based on the anatomy of all that.
Yes.
So from the upper, we talk about anything that affects the nasal airway, the mouth. They have a connection that feed into a part we call the pharynx, that also feeds into a part we call the larynx, and then now the trachea. So we divide it there at the larynx. For anything above that, we call it upper respiratory tract, and then everything below that, we call it lower respiratory tract.
It's quite a biology class here.
It's a biology class, it's an anatomy class.
Yes. Now, we're talking about let's start with, the upper infections, respiratory infections. What are they and what causes them?
Good question. So basically, I can just maybe highlight a few and then we can talk about how they occur or what happens. So first, for us to call it an illness, it's a deviation from the normal. So maybe a child who is sneezing a lot, coughing a lot, a dull child, a child who is having difficulty in breathing, or a child who is also wheezing or producing any abnormal sound while breathing may have concern for a respiratory illness. So to now what may cause these illnesses, again the etiology or rather the causative agents are many, but 90% or a huge majority of them are caused by viruses. And then a small percentage are also caused by bacteria, and those bacterial infections can then complicate and become, severe diseases affecting the lower respiratory tract.
And why is it that it's the children who are mostly affected by this, infections and viruses?
Interesting question. So yeah, we say children are vulnerable. Why? Because even after they are born, there are some parts of their body that still continue to evolve. So these parts of their body include what we call the immune system. And the immune system is what fights diseases and fights illnesses. So these parts of them are still in evolution, and that makes them very vulnerable to diseases. So that's why.
Okay. Could you name perhaps some of the common infections, especially with the upper respiratory tract?
Good, yeah. So the upper respiratory tract infections you could visit your doctor and maybe you have a flu, some cough here and there, what we call common cold, yeah. When it's affecting the nose and there's a lot of runniness, you know, we call that rhinitis. And then when it's affecting now the part I told you, the throat, the pharynx, we call it pharyngitis. So itis in medicine means inflammation.
Okay.
Inflammation means swelling and leaking, okay? So that's why your nose is leaking. It's leaking of mucus, so we call that rhinitis. Your throat is red and hot and it's aching and it's leaking. We call that pharyngitis.
Okay.
You get it? Yeah, so if it goes down lower below the pharynx, that the part we call the larynx, again, sorry for all the anatomy, we call that laryngitis. So again, it's inflamed, it's swelling, it's leaking. And what is leaking at this point is mucus. Okay. So just to name but a few, in the upper tract, those are the common ones. Common cold, basically, that's how we refer to it in layman language, but just specific for the parts that it affects, that's what we would call them.
And is there a difference between common cold and a flu, or it's just one and the same thing?
That's
yeah.
I stand corrected, but I don't think there's a huge difference. Rather, it's how we commonly refer to it as possibly being caused by influenza. Influenza is one of the viruses that would give you common cold symptoms, but then it has evolved and can also cause more severe illnesses. But there's no difference. There's no major difference between common cold and what we ordinarily call flu.
So do all this, you know, infections share, you know, the children present the similar symptoms for the three that you've mentioned?
Yeah. So for the three that I have mentioned, the symptoms may evolve more so to just look like the same, like in a blanket format. And the symptoms I'm talking about basically, because I said that there's a lot of leaking and a lot of irritation. So because of that, we will have symptoms of a running nose. Because of that, we will have symptoms of maybe an itchy throat, sticky throat, coughing, sneezing, and all this is meant to try and eliminate all that mucus that is being produced. There may be a lot of inflammation, especially around the throat. Their tonsils may get swollen as well.
Okay, so pharyngitis is the ones that the tonsils are aching?
Yes, and they may get swollen so much as the child cannot feed. So now these are other, we call them constitutional symptoms that are related, not necessarily to the eliminating event, but just because of the virus stroke the bacteria. So they may have fever, they may have refusal to feed, they may just have general, you know, they are just lethargic. They just don't want to do anything. A child who is very, very playful, you'll hear the parent saying, this is just not my child, doctor. So that's also a sign for us, a sign for illness.
Okay, and do these illnesses, only affect children? I know we are focusing on children, but are there other people who are at risk of, you know, getting these infections?
So in general, they don't only affect children, they also affect, it's a whole spectrum from children to adults. As a matter of fact, mostly children will get these infections from, as much as they get it through each other, mostly they also get it from adults. And since adults have stronger immunity, the disease may not manifest so aggressively in them as it would in maybe a 6-month or a 3-month-old baby. Nonetheless, we usually say that a child under 2 or between 0 and 5 years will get an average of 3 to 8 or even more if they're going to school, upper respiratory tract infection. So sort of just to create, to help the parent know that this is actually normal, that now this is maybe the second runny nose we are getting. Don't panic, don't start removing the child from school. That will happen. An average adult, I don't know how many flus have you gotten?
Well, not this year. God has been graceful. Yeah,
maybe 2 to 3. Yeah, so of course there are populations of adults that are also at risk, and these are pregnant women, because obviously pregnancy is an immunocompromising state. Older people, the elderly, or people with other specific illnesses that affect their immunity, like diabetes or chronic diseases like cancer.
Okay.
Yeah.
All right. And when does a child stop being so susceptible to these infections? Is there an age that they'll get to, and then now the number of times that they're getting these illnesses reduce?
I may not have the specific answer for that, but can we modify the number of times a child can get ill? Yes, we can. Number one is at least between the age of 0 to 6 months, we say breastfeeding helps reduce upper respiratory tract infections by 60%. And that's huge. Yes. That's huge. So you'll find breastfed babies literally because of all those good immunity that they've gotten from the mom's breast milk. They hardly get ill, and even when they get ill, the milk already has tuned to treat them, if I may say so. So it's sort of a protective mechanism. Other things that may help, protect them is good nutrition. Good nutrition is key to good immunity.
All right.
Number 3 would be hand washing. Hand washing is very underrated, but remember, these infections are spread through, we call it droplets infection. And so when you have droplets of like, let's say I have an infection.
Yes.
And I'm talking to you right now. I'm spitting some things. Some things will land on this table. They will be on my hands, especially because I may sneeze into them.
Yes.
I may touch my phone. So all these formats, if a child touches or comes close to this kind of droplets, they are likely to get the infection. So if I wash my hands, it also reduces the rate of infectivity. But ideally up to around 6 years, then you should start seeing a decrease in the number of episodes that the child gets per year.
Oftentimes these infections comes with a fever, and you find a child has a fever at night. How would you advise a parent to go about it before they see a doctor?
Yeah, so as we said, most of these upper respiratory tract infections will be caused by viral infections. And the reason we emphasize this is so that we don't misuse our antibiotics. So we encourage that if the child starts showing signs of, runny nose here and there, coughing, poor feeding, but still the child can feed, the child is not refusing to feed, there are things that you can do at home. Like, it's okay to have fever medication at home. And this fever medication you'll be given by a pediatrician or a doctor and guided on how to give it. Usually most of them we will say give at least every 8 hours for the first 24 to 48 hours.
Okay.
If you do not see a change, then come to the hospital.
All right, Dr.
Then, yeah.
Okay, I'd love for you to hold on to that thought as we get to our first commercial break. When we will be back, we will now get to hear from Dr. on some of the lower respiratory illnesses. Do not go too far, but first take a look at some of the myths and facts of the day. Inhalers are not good for children. Inhalers can be used appropriately with guidance from the doctors to control asthma. There is nothing you can do if your child gets a flu. If your child gets sick, see a doctor to discuss treatment options. Prescription antiviral drugs can make the illness milder and prevent serious flu complications. All right, welcome back and thank you for keeping it TV 47 and of course Body Garage, where on this episode we are focusing on respiratory illnesses, especially in children. And with me is Dr. Ora Nzinga. So before the break, Dr. we had touched on some of the home remedies. So at what point would I now know that it's time to take my child to the pediatrician?
Good. Yeah, so just to expand a little bit on the home remedies, we talked about the fever medication. There are also other home remedies that we encourage. We discourage the use of cough syrups that are bought over the counter because of the immense unregulated side effects that they can cause. So we encourage the use of things like honey, especially at least for children above 1 year. Don't give honey to a child below the age of 1.
Why is that?
Why? Because sometimes, or rather, children below the age of 1, there's a certain bacteria that can be found in honey that can cause some sort of paralysis in them, and this can be fatal. So we discourage the use of honey under the age of 1 year.
All right.
So for children above 1 year, a teaspoon of honey, a teaspoon of lemon, a teaspoon of ginger mixed is a good home therapy for cough. And honey itself is an antibiotic, it's an antiviral, it's an anti-inflammatory, and you can make this concoction and take it as a household shot.
All right. Okay. Now, at what point should I now consider taking my child to the pediatrician?
To the pediatrician, yes. So we have something we call danger signs that we teach to every parent to be able to recognize fast and rush the child to the hospital. And these danger signs include, as I said, fever that is not breaking with the anti-fever medication. Number 2, a child who is unable to feed is a danger sign, and that needs urgent review. A child who has difficulty in breathing, and you know how to tell that a child has difficulty in breathing is sometimes they will be breathing through their nose, they are making sounds while breathing. You look at their chest just below the under ribs, that the chest is buckling in and out, as well as the abdomen. That means they're using extra muscles to try and sustain their breathing. And so that's also dangerous. A child who is obviously, now weak, lethargic, they're not able to support their own hydration, that's a child you should bring to the hospital immediately.
What happens if these infections or illnesses go untreated?
Good. So if they go untreated, first of all, they can clear. Most of them will clear. 7, 10 days, some may even go up to 14 days, but they will clear naturally. So a viral infection has its own course, and the course must go on and complete itself. So it's not that you will have a viral infection today, Monday, and by Tuesday you go to the hospital and everything clears by Wednesday. It has its own course that it follows. Now, for those that don't clear, unfortunately, they now may go down lower to the smaller airways, and then find their way now into the lungs and cause pneumonia. Pneumonia basically just means pneumo is air.
Yes.
The lungs are full of air. So it's just infection of that area we call the lungs, basically. So that can happen. This infection of the lungs can also complicate further and cause leakiness of fluid into the lungs, or even pus collections around there. On the upper part, These infections can also affect the ears and cause ear infections. We call that otitis media. The pharynx, the tonsils can complicate and have like pus or form pockets. So those are the kind of complications that can happen. And now that will require hospitalization, obviously, for further management.
Okay. You've mentioned that we should avoid over-the-counter drugs because it can cause some harm. I wonder, what do you mean by that? Because oftentimes when someone has a cold, my first instinct is to get to a pharmacy and get over-the-counter drugs. So how can it cause harm for my child?
Yeah, so how I'd explain this to you, Sheila, is remember what we said, how does this infection occur? So once you get infected by the virus or the bacteria infection, there's inflammation that goes on inside that area. So let's take, for example, the lungs. And as I've told you, inflammation will cause leakiness. Leakiness is the fluid, the mucus, that's what is produced in this place. And mucus is meant to guard you, and it's also meant to remove things out of your system. And you cough so that you remove that mucus, so that you eliminate that virus. So most of over-the-counter cough syrups, they're meant to suppress coughs. So a cough is not a really, really terrible thing. Sometimes it's part of the healing journey. So if you suppress the cough, then what do you think happens? The mucus, the collections, they remain there. So what is likely to happen is complications, definitely. The cough will be suppressed, but there will be now complications. The bacteria can thrive over there and form collections of pus and form, fluid. So it's those kind of complications that we try to avoid. Number two is when you use some of these over-the-counter medication contain, let me just call them chemicals or other medications that affect the brain. So may cause sedation as well. So a child may appear to be more sleepy than usual. They may be associated with other, neurological issues, including hyperactivity, as well as, a depressive state of the brain. And on the worst case scenario, breathing difficulties. Remember, the breathing center is in the brain. So if that is suppressed, then it may even be fatal.
And okay, that's important to note. And I'm wondering now, normally the treatment of these colds is by use of antibiotic. What is the role of antibiotic? How does it cure the infections?
So we use antibiotics for bacterial infections, and antibiotics cannot cure viral infections because viral infections are caused by viruses. So things like pneumonia, sometimes when you have a viral infection, it can suppress your immunity so much so that now the bacteria coexists together with the virus. And in most of these instances, then we use the most common antibiotic that, I've lost my train of thought. But the antibiotic that covers the most common bug that would cause pneumonia in that age group. So we choose antibiotics based on the symptoms and based on the severity of the illness. But for majority of viral infections, we don't have specific treatment for them, and we do what is called supportive care. So more like what we do at home. In the hospital, we will still give you fluids, we will give you, pain and fever medication. And then there's just one or two viruses that have specific treatment now, like influenza. Influenza has a specific antiviral medication that we use to treat, especially in severe cases, to just sort of reduce the effect of the virus.
Okay, so when we were starting, you said that sometimes from now the upper respiratory infections can cause now lower respiratory illnesses. First, where first is the lower respiratory tract? What does it comprise of, and how does that happen that now it causes a complication?
Yeah.
Yeah.
So the lower respiratory tract is basically, as I said, from now the trachea into the lungs. And so, you know, the airway, it starts off big.
Yes.
And then it continues to subdivide into very small small parts, so that the entire lung can be can get what's supposed to get, the air.
Yes.
Right. So when you have an infection, you're secreting all those mucuses. Some viruses, some bacteria can find their way into the very small airways, and then, you know, affect those regions. And that's how pneumonia happens.
Okay.
Yeah.
So it's basically just pneumonia for the lower.
It's basically pneumonia.
Okay.
Yeah.
What are the symptoms that, you know, a child might present when they have that infection?
Yeah.
Or illness?
So actually, any child with cough plus fever plus fast breathing, we call that pneumonia. It's a clinical diagnosis. You don't need to do any blood tests to diagnose pneumonia, and off the bat, we treat that child as pneumonia. Yeah.
And where does asthma then come in?
Good. So asthma is a different entity. However, it's also part of the lower respiratory tract as well as the upper respiratory tract. It's not an infection per se. It's sort of kind of genetic deviation, whereby their airway, their airway is more prone now to, we call it a hyperinflammatory state. So such that if this is like, if a virus comes into you, there's a certain amount of inflammation that you're supposed to produce, right? But in an asthmatic individual, their sort of immune system is hyperactive, such that they will produce a lot of mucus. Their small airway will constrict, we call it bronchoconstriction, and then because of that constriction, then they sort of trap a lot of air in, and when air is trapped in, then it cannot come out. So imagine that tube is so small because it has constricted, and it's full of mucus, and air is trying to pass through the very small tube. You'll now hear what we call the wheezing sound. It's like whistling. I can't whistle, but if you just narrow your lips, I guess, you'll produce that wheezing, what we call wheezing sound. And it's just air trying to pass through very, very, very constricted tubules. Yeah, so in the event that they have an infection, just like any other child, they may now, you know, present as more severe case because of the difficulty in breathing and because of that bronchoconstriction that will now need to be relieved by special type of medication that we administer either through nebulization or through inhalers. Yeah.
So it's not that when the upper and the lower respiratory illnesses get worse is where it can lead to asthma?
No.
They're not connected.
They are not connected in that way. It's just that sometimes there are some viral infections that will make your airways behave like asthmatic airways, and you may also wheeze. And even in those instances, we may treat it like asthma. We call it viral induced asthma. And so we don't even diagnose asthma in very small children, at least not below 1 year. And this is the diagnosis that I encourage. Let it be made by, you know, a chest doctor, a chest specialist, because majority of the wheezers will be viral induced. But of course, when it's now occurring more often and sometimes not even related to the illness, then it may need further evaluation and classification as asthma.
Right. Thank you, Daktari, for that clarification. Even as we are up for our second commercial break, when we will be back, we will now get to hear from Daktari on how we can prevent some of these lower and upper respiratory tract infections and illnesses. Do not go too far. Keep it TV 47. All right, welcome back and thank you for keeping it TV 47 and here on Body Garage with Sheila Chelangat as we delve into the respiratory illnesses, especially in children. And Daktari, before the break, we have, clarified the difference between, asthma and the relation with the upper and lower tract respiratory illnesses. And for the lower respiratory illnesses, are they contagious?
Are they contagious? So just to answer that question, yes, how they are spread is through what I have called droplet infections or sometimes even close contact. So any contact that is around within a meter and even some more in some instances can cause these infections.
Yes.
Okay, so as long as the individual is exposed to these infections for a certain duration of time and through such contact with such objects, then they can get the infection. Yeah, and this spreads across all of them, the upper as well as the lower. And including other diseases that probably we have not mentioned, like TB, COVID is also a viral infection. And you remember how, judging from the mechanisms that were put in place to prevent it, then it should go without saying that close contact
is not good.
Yes, exactly.
Okay.
Yes. Yeah.
All right. For pneumonia, what happens if it is left untreated, especially in a child?
So, good question. If pneumonia is left untreated in a child, as I said, it can complicate, so much so that, it can affect not only the lung itself, but the bacteria can also get its way into the bloodstream and even go into the brain and even cause, what we call abscesses. It's the same bacteria that can also cause an infection of the heart that we call endocarditis. The abscesses that I talked about, the fluid that can collect inside the lung, that then can, lower the immunity much further and invite other infections.
Yes.
Yeah, so that.
Okay. All right. And moving away from now pneumonia, how it can actually, get worse. I'm wondering now, what is the treatment of pneumonia looking like? Is it just antibiotics too?
Good. Good question. So when we make a diagnosis of pneumonia, first of all, besides just treating the infection itself, in terms of treatment in the hospital, we divide our treatment into something we call definitive care and supportive care. So supportive care is focused on making the patient comfortable, even as much as we try to treat the disease itself. So supportive care will include things like fluids if the child is unable to eat orally, oxygen, because what happens is now their work of breathing is increased. And this is because of now the mucus plugs that are formed inside the lungs. And so, we breathe in air to try and get oxygen into the blood, and oxygen is the one that is critical in almost all functions of our body. So if the body is not getting enough oxygen, then it doesn't work well. And that's why you get weak. You can't, walk, like, for example, a child who is lethargic. And so it increases it demands more So what now, that message is sent back, and the muscles are told, you need to work harder, we need to get more oxygen. So that's why we give you oxygen, to try and supplement that difficulty that is encountered because of the disease. And then now pain medication, fever medication, all that is supportive care. We may do a bit of chest physiotherapy if, you know, the chest is so severely congested. And then definitive care now is what will, you know, treat the infection itself. And that's where we talk about now our antimicrobials, like the antibiotics, just what drug is specific to the disease. If it's TB, it's anti-TBs. If it's asthma, then we will give specific medication for that. Yeah.
And for all the illnesses that you've mentioned, starting from the upper to the lower, how long do these, you know, illnesses last?
Yeah.
If you could give a range.
If I could give a range, so if we start from upper, and which I told you majority are viral infections, they will take anywhere from 7 to 10 to even 14 days. Some symptoms may linger even longer, like the cough may linger even for 3 weeks sometimes. But of course the child is not, you know, sickly, even as they cough. It's just that there will be a cough here and there. For bacterial infections, we don't give it a duration per se, because ideally they're not supposed to last. When we are supposed to identify early and treat.
Yes.
And then for things like TB, any child who has had coughing for more than 2 weeks, is losing weight, is having a lot of fever and night sweats, that's a child that may require to be you know, investigated for TB. So that can also, the cough for that and other associated symptoms can last long. Yeah.
Now, let's talk about caring after they've gotten treatment from the doctors. Let's start with a child with common cold. Would now that force me to tell my child, you know, stay at home so that I can manage this particular infection? How do I care for a child who has, you know, these illnesses?
Yeah. What I say is rest is essential. When, I mean, even you, when you have a flu, I'm sure you ask your boss to give you a break. So even children, well, they have, you know, common colds. If you can give them a break from school.
Yes.
Day 2, day 3 are usually the worst days. That's what I say. So for that period when they are acutely ill, you want to keep them away from other children, because obviously the spread is through contact and droplets infections. So you want to keep them away from school for a period of maybe 5 days. That's the incubation period, is a period through which the spread can occur.
Yes.
But once the illness starts and it's like 4 days, 5 days in, the child is getting better, then there's no cause of alarm. They can go to school.
They can go to school.
They can go to school.
Are there foods that a child should should avoid when having these infections?
Are there foods?
Because normally I hear, sugary foods are not good for the cold.
Yeah.
Is that true first?
So that's it's sometimes, myths have some truth around them. I don't completely discredit them, because the people who formed them, they had their reasons behind them. But scientifically, cold foods do not cause like tonsils or pharyngitis. They do not cause that. But in a child whose throat is already inflamed, irritated, he's coughing, adding sugar onto that may worsen the irritation. So I think this person who said this for the first time had a point. Alikuwa na point. So haimaanishi you take them away completely because they will give you tonsils. No, they will not give you tonsils. But in that time that the child is ill, it may probably aggravate the symptoms. But yeah. Other foods that may influence the course of disease. I think, you know, eating vitamins, like vitamin C rich foods, have been shown to reduce these illnesses. Yeah.
Okay. Now, you mentioned sore throats, and it can be really a discomforting, you know, infection for a child. Are there remedies at home that a parent can take so that this child at least can eat better, can feel better, even away from, you know, the medicines from hospital?
Yeah. Yeah, so the remedies, the home remedy is sort of, we call it dawa,
Yes.
the concoction that we make. And how you make dawa, it's pretty easy. You just take a teaspoon of honey, take a teaspoon of ginger. You can do the ground ginger, a teaspoon of turmeric as well, and lemon juice. And then you can blend it, or you make, you know, the concoction.
Yes.
And then just give a teaspoon every 8 or 12 hours. That will reduce, it helps soothe the throat. As I told you, it's also an anti-inflammatory, it's an antibiotic. It's an amazing thing.
Yeah. Now, for maybe my child who has not yet contracted any of these illnesses, is there a way that I can prevent it from happening? What are some of those tips that I should take as a parent and, you know, help my child so that they do not contract some of these infections and illnesses?
Good question. Hand washing, hand washing, hand washing.
Muhimu.
Very, very important. Key in preventing respiratory illnesses. And then it has actually been shown to prevent more respiratory illnesses than it would prevent diarrhea. Because you would think hand washing, we wash our hands to prevent diarrhea, but it has been shown to prevent more respiratory illnesses than it would diarrhea. Cough hygiene, sort of teach your children how to cough. Teach them to cough into the elbow and not into the hands, because the hands are likely to touch somebody else even if they forget to wash their hands after, you know, coughing. So again, after coughing, bouts of coughing, sneezing, let them wash their hands as regularly as possible. We talked about breastfeeding for the very younger ones. Is very protective. The longer you do it, the better. The current recommendation is up to 2 years.
Yes. 2 years is a long time, Doc.
I know. But it will save you a lot of hospital visits. Yeah. Yeah, so breastfeeding, there's hand washing, there's you know, cough hygiene, vaccination. Yes. How's that? So vaccines these are actually ranked highest at prevention of respiratory illnesses, especially pneumonia. So we give vaccines to prevent respiratory infections starting from actually birth, because at birth we give TB vaccine. Yes. And then around 6 weeks we start now the course of pneumonia vaccine. We give a vaccine that also prevents a disease called pertussis, and this is sort of affects the very younger babies a lot. We also have a vaccine for influenza that is given around 6 months. Yeah, so we have vaccines that help prevent these infections. But your biggest tip and pro tip to parents is to teach their children to normalize hand washing. Let them normalize hand washing. Yes. All right. Dr. Asante sana for taking us through this particular episode as we learned how to even prevent some of these respiratory illnesses in our children. Karibu, Sheila. Thanks for having me. It was a pleasure. And thank you for keeping it TV47. We have come to the end of this particular episode. I hope that you have learned and grasped as much as you can. Thank you for keeping it Body Garage. And of course, thank you for always viewing and coming back each and every Thursday. From me, it is good night and goodbye.